Okay, hi Megan, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. That blue cannula you see is coming in the front of your shoulder. And remember, you're laying on your side, so your arm is actually up in the air right now. We're just going to place a shaver in, and that's going to help us start to identify the anatomy and make a plan here. Your biceps tendon is always the first thing we identify, and there it is right here. So a little bit of fraying on the labrum down here. I'm going to use the shaver to smooth that out so we can see if the labrum's detached or not. Okay, so far so good. A little bit of tearing in the labrum, but it doesn't appear to be what we call a slap lesion, a true slap lesion. Now the rotator cuff is up here, and there's the tear in the rotator cuff. See that hanging down there? So I'm going to start the shaver here. It doesn't look as bad as it really is right now, but that's the little gap in the tendon right there. So it's in the anterior part of the supraspinatus tendon. Now, when it's torn like this, we often use a marker stitch so we can find this area very quickly on the other side of the tendon. Otherwise, the other side could look just smooth, like normal, and be hard to tell where it was torn up underneath here. So that's why we use our marker stitch. So in just a minute, we're going to pass a marker stitch through, but you can see the tear right there. This is exactly what the ultrasound showed us in the office. In terms of the rest of the joint looks great. No signs of any arthritis. The glenoid down below looks good. The humeral head up above looks good. And so really the next thing we're going to do is take a spinal needle Can you turn my outflow down on the pump, please? There should be an outflow down. Yeah, great. Okay. And so now we're going to take our spinal needle and pass it right through this part of the tendon that's torn. And there's a bullseye right there. Okay. So we're going to pass a marker stitch through there. Hold the camera, please. In two hands. Yeah, perfect. And so this marker stitch is temporary. Two hands on this. So your only gig is just holding the camera right there. And once we have enough, I just need a pair of Mayo scissors, please. Once we have enough in, we'll just back the needle out and cut the marker stitch. But now we have this purple stitch marking where we need to be. So we'll go off on the video. We'll show you some more once you change positions with your shoulder. Okay, so we've taken off a little bit of bone from the acromion. We can show you that at the top of the screen there. And now you can see why we use a marker stitch. On this side of the rotator cuff, it actually looks pretty good, but we know that you've got, about an 80%, 90% tear. So we'll take a grasper here and take that marker stitch out. And now we know right where the tear is, so we'll get to work and open that up. Okay, so we've unroofed this tear. Let me show you where we're at. There's the articular margin right there. And so we're going to place an anchor down, a triple loaded suture anchor, and get about repairing this here. So as we look down at this, there's the tear. We'll take a spinal needle next. And so there's the articular margin. We're going to get all that down. I think that's a better angle for us. Okay, so we're going to place an anchor right about there. Okay, so here's our triple loaded anchor down in the bone here. And we're going to start with this solid blue one first. So we'll take this out anteriorly, just like that. And now we're going to use this cannula on the right side of the screen to pass the suture through. We'll show you some more in a little bit. Okay, so this is how we kind of rehearse our stitch. We're going to pull back on this cannula just a little bit more. And so we'd like that to come out right about there. I'm going to pull back. And that gives me a suture all the way through. I'm going to feed the relay. Pause. Okay, so we're all done here. Let me get this cannula out of the way. There's our triple loaded anchor. You can see how we organize the sutures to get this to lay flat, so that looks great. There's 1, 2, 3. The last little trick as part of this, what we call a SCOE row, is to make a little hole in the bone right about here just to help some of the marrow elements come out. Hold the camera just for a second. And so with this small tear, we just probably have to make one of these little portals, just like that. And what that will do when I turn the pressure down, that will allow some of the bone marrow elements to come out. And actually, if we look carefully, you'll see some of these little droplets start to come out of the bone there, and that helps the healing response. So we're going to finish up here. Good luck to you now. I really hope that does the trick for you, okay? Bye-bye.